and really excited to introduce our next group of panelists from Ellipsis Health. One of the leaders in this new virtual mental health world that we're experiencing, that we're now endeavoring. And welcome, really my pleasure to welcome Dr. Victor Carrion, the co-founder and chief clinical officer of Ellipsis. Melissa McCool, what a great name to begin with, Melissa, but the chief product officer of Ellipsis, and really excited to have also, I just lost the slide here. One second, everybody.
Stan, good morning. Just a correction. I am the advisor and Dr. Mike Aratow is the co-founder.
Oh, right. Thank you. Okay, that's really good to know. Thank you very much. And well, anyway, really welcome to have you. Really glad to have you all here, and appreciate jumping in and talking a little bit. Maybe you could start off by giving like a 1-minute background on each of your personal histories and your professional histories.
Sure, I can start off. Again, I'm Dr. Mike Aratow. I'm the co-founder and chief clinical officer at Ellipsis Health. And my background is almost 30 years as an emergency department physician, and almost 15 years as a health IT executive at a hospital and clinic system. Victor?
Hi, I'm Victor Carrion. I'm a child psychiatrist and adolescent and adult psychiatrist who have been in the mental health field for about 30 years, 25 of those at Stanford, where I am now vice chair of the department, and I recently joined Ellipsis in the advisory team.
Perfect. And Melissa?
Hi, good morning. My name is Melissa McCool. I am a clinical psychotherapist. For the last 20 years, I've also been working at Kaiser Permanente, and I also co-founded a company called Stella Care, which is no longer in business, and I've been working now with Ellipsis doing clinical product development.
Wonderful. So let's start with you, Melissa, and just ask right off the bat. We're looking at this virtual first healthcare system. You just heard from Don and Sam, two of the leaders in this area, certainly in GI as well now. What are you seeing as some of the optimal ways to combine digital interventions with existing treatment options like medication adherence and psychological therapies in order to make sure that we can maximize diagnosis as well as treatment and long-term management for optimal outcomes in mental health?
Yeah, well, it's actually very exciting in the mental health field because over the last couple years, there have been two incredible new developments that really help both patients and providers. The first one I would say is it's very easy now for patients in under 5 minutes to do a screening. So we can basically assess their symptoms and screen and monitor how they're doing. And this saves time for providers in session because you don't have to spend a lot of time finding out how they're doing. You now have quantitative data which tells you how they're doing. And they do this before the session and between sessions. And they can do it through an iPad with, answering questions like companies like Tritium offer that, or like at Ellipsis Health, what we do is we get a short audio sample with a journal. And then with that, it basically provides the mental health provider with these metrics. Based on the metrics, you can change the treatment plan, and adjust accordingly. So that's been, again, game changing. The other thing is that it used to be, for instance, like if I had a patient who had OCD, between sessions, I might give them a book or some homework to do. But now what you can do is you can actually send them to an app for these computerized and digitized interventions, which are evidence-based, like NOCD provides that, as well as Silver Cloud, and even on Calm, there are all sorts of interventions. And these interventions are, psychoeducation and basically helping the patient to learn coping tools, so that when I see a patient, if I know that they're getting these tools outside of session, I can actually devote time during session to really deal with the deeper underlying issues that are going on.
That's brilliant. Well, thank you. And that's a great explanation as well. And Dr. Carrion is vice chair of psychiatry and behavioral sciences at Stanford University and an advisor to Ellipsis. What are you seeing as the benefits and risks of delivering mental health care through these sorts of online virtual technologies versus face-to-face interactions that you've been so accustomed to over the last couple of decades?
Yes, thank you, Stan. In mental health, we're really welcoming technology. We have a big access problems. We have half adults and half to 2/3 of children and adolescents that need mental health not being able to access it because we don't have as many providers as are needed for the people that need mental health. Technology will really help us with that, not only in terms of numbers, but in terms of geography. There are people that live very far away from centers that offer mental health services, and now they will be able to access some of these issues. It is also good for research because a lot of interventions need to prove fidelity and consistency, and in technology we'll see that will be easier because there are pathways that need to be followed and algorithms that are developed. Another benefit is the rapid communication between the patient and the practitioner in between sessions, like Melissa was mentioning, but also between practitioners themselves as they consult each other and they interact with each other. There are a few challenges. We know that 50% of youth now that are trying to do schoolwork via the internet are having difficulties with connections. So we really need to improve internet connections so that they can use technology that will be available. Also, there is an art aspect of therapy that technology will have to address in terms of being able to, in a relationship, to read someone, to read their facial expression, to identify a gap in the narrative. For example, there's something in psychology and in psychiatry that we call a corrective emotional experience, which is when something improves because of the relationship that you are having. So I think in general, what we are going to have to do is create combinations, like you were mentioning, having hybrids, not a complete jump from person to technology, but having hybrid interventions.
That's brilliant. That makes so much sense too, just given what's happening in healthcare. And we've seen, it's not just services, right? But we've seen over the past 20 years, a lot of molecular therapies and device therapies become hybrid in nature. So it's not just a molecule, but you need to have a digital. And I've done hundreds of digital health studies over my 30 years in research. And I can tell you that it's always interesting to see how digital plus the traditional therapy makes such a big difference, and really does have the penultimate outcomes improvement. And certainly Dr. Aratow, I think, first of all, congratulations on co-founding such an amazing company, and now as the Chief Clinical Officer of Ellipsis Healthcare. Give us a good understanding around this idea of the intervention and the digital intervention, because one of the core components, one of the core issues that we've seen is communication gaps around providers, payers, patients, most importantly. And how do we see these sorts of digital interventions reducing those communication gaps?
Yeah, I think Victor had touched upon it just a second ago. I mean, obviously, now that we have billions of these in everyone's hands, this becomes an instant channel between the patient and the whole healthcare team and also the payers. I just wanted to say before going any further that there's an important thing that we have to consider, and that's privacy and security. And for these interventions to have enhanced communications between all the stakeholders, we have to keep in mind that people have to give their permission and have to understand what they're doing. Otherwise, they will not use this, and if they don't feel comfortable. So I think that's just really important to point out. But putting that aside, and that's for, I'm sure, a whole nother discussion. The cell phones and the tablets, et cetera, I mean, this empowers the patient because they can do things wherever they are, whenever they want. And this convenience forces sort of enhances an engagement. And because of that, they use these interventions, and if given the permission, this automatically gives a stream of data, as both Melissa and Victor were saying, to the providers, and if permission granted to the payers to see what's happening with the patient. Because up until this point, mental health providers and physical health providers really haven't had a good visibility all the time into what their patients are doing, besides during that limited clinical encounter of just a, could be 45 minutes for a mental health session. And so this really makes them, give them a better understanding what's going on. With the payers, it gives a chance for them to understand what their members are doing. It gives, I know they've always had a struggle with the member and the payer to have that relationship, but if they get real engagement with these digital interventions, which they can be, that gives them a much closer bond. They can understand more about their members. They can risk stratify what their members, their member groups, and then they can also help divert them to appropriate resources.
Okay, yeah, that's definitely spot on. We've got a few minutes left, and I'd love to get back to Melissa and just understand more around what you guys are doing and how you're including some of the core elements of therapy, things like empathy and gestures, nonverbal cues that normally happen, face to face, and how you do that on a digital intervention virtually.
Sorry about that. Sorry. I'm a big fan of technology, but I think it's very important to state that there's a limit to what technology can do. And I say that as a therapist who's been for the last, 10 months, since this pandemic started, mostly doing, online sessions. There's something, because emotions live in the body, when you're with someone in person, you can actually feel what they're feeling. And you can use that to actually help the patient learn to identify emotions and work with emotions. And that becomes hugely important because emotion drives most behaviors, conscious and unconscious. So I found that to be very challenging. Another thing that is challenging, especially doing like telehealth and video sessions, is where the camera is located. Because if you, for the patient to think that you're looking or to see that you're looking them in the eye, you actually have to look at the camera. But when you're looking at the camera, you actually are missing all of the body cues. And so I think that's very much a challenge. So I just think it's important. I think what Dr. Carrion said is important, that we end up thinking of it as a blended model where you use digital therapeutics to help augment. But in my personal opinion, there's nothing that will replace face-to-face sessions. There's nothing that is as powerful. I know that's provocative to say, but.
Now I think it's important to say, and I think, we have to be realistic as we're entering this new reality of virtual first. And we want to make sure that we're setting expectations properly and along those lines. But just a terrific panel. I feel better just knowing that our virtual mental health future is in the hands of such brilliant scientists and researchers, physicians, and technologists. Thank you all for